Hello everyone, welcome back to the channel. Today we will be starting, or I should say continuing with the part 2 of dental amalgam. If you haven't watched part 1, I would request you to watch that so that you understand the video better. So moving forward, we came to the advantages of the amalgam. Like, why do we use amalgam? Why do we prefer amalgam over any other thing? It is easy to insert. You do not need to know any particular technique, so you can say that it is not very technique sensitive. It has got a long service life. If a patient is getting restored by amalgam, the durability, or say the service life, will be comparatively longer. It is cheaper than gold and composite. Not everyone can afford gold restoration or a composite restoration. It is a self-sealing product, and less time is required for this restoration. Also, if someone is allergic to composite, he can go for a amalgam restoration. Now, coming to the disadvantages of amalgam, aesthetics are affected. Of course, it is silver in color, does not look very good on aesthetics, so is limited to the posterior region only. Amalgam is very brittle, so it can easily fracture. There is huge loss of tooth structure. This means that when you are doing the amalgam restoration, you need to have proper features for that restoration, like a box shape cavity and a flat floor, everything. The retentive feature should be very accurate. So in creating that box shape cavity and everything, there is loss of a huge part of tooth structure. They do not bond well to the tooth structure. This is a major drawback. They are subject to corrosion and tarnish. Risk of mercury toxicity is there. Also, delayed expansion risk is there. I will tell you next that what are these things. So if we come to the problems or complications of amalgam, the very first complication we have is delayed expansion. Now, what is delayed expansion? Whenever you are using an amalgam which is having zinc in it, okay, remember, when you are using an amalgam which is having zinc in it, and if that zinc comes in contact with saliva or any kind of moisture, there are chances that delayed expansion will happen. Now, what is this delayed expansion? The restoration of amalgam which you have done in the patient's mouth will start to expand. So, if zinc containing amalgam is exposed to saliva or moisture during the process of condensation, or maybe prior the process of condensation, there are chances that the expansion of the restoration can take place, which is known as delayed expansion. Now, this situation usually occurs after 2 to 3 days of the restoration is being done. It's not an immediate process. It takes a time of about 2 to 3 days. Now, what are the harmful effects of delayed expansion? You see in this particular figure, you can see that the restoration which you have done here, the amalgam restoration, it has kind of expanded. It has came out of the cavity. Otherwise, you see this gap here, this little bit, it was supposed to merge in with the tooth structure, but because it has expanded, it has disturbed the occlusion. Now, what will happen because of this disturbance in the occlusion? There can be post-operative pain. There can be loss of the tooth cusp may fracture, and there is high risk of corrosion. Also, secondary caries can occur because there can be food lodgement in these areas, and chances of secondary caries have also increased. Now, coming to another complication, that is mercury toxicity. Mercury toxicity is not that quite common kind of thing, but it does happen. What happens is, you know that mercury is a very toxic material, is a very toxic compound, and it is usually suggested to us that we should not have free form of mercury in the environment, because for example, if we it is on the table, just bare on the table, so maybe it can come in contact with the skin, or maybe we can inhale that mercury, and it can be a very hazardous condition. So mercury is toxic, and it is suggested that free mercury should not be exposed in air, as it can be hazardous. Now, how can mercury toxicity occur? For example, if a patient has came to you who has already been done with amalgam restoration, then at the time of removing the old restoration, it can happen. Maybe the mercury vapors have been inhaled or absorbed at the time of trituration. That I've already told in video 1, what is in part 1, that what is trituration. If mercury is spilled on floor by mistake, can also be a form of mercury toxicity. Now, what can happen in the body when mercury toxicity happens? If the level of mercury in the body increases, then it can lead to these amalgam tattoo formations. You see these darkened structures in the soft tissues, and that is the thing which you say as amalgam tattoo. Now, how to dispose amalgam very properly? It is very important that when the excess of the amalgam, which is not being filled in the cavity or which is being burnished out, is to be disposed. Now, how are you going to safely dispose this? Either you can use the radiographer fixes solution, or there are specialized amalgam disposal kits like this which can be used to dispose the amalgam scraps or the mercury which is being left. They can be recycled later. So always remember, it is the responsibility of a clinician that the proper disposal of amalgam should be there. It should not be left free in the environment, because the dentist and the dental assistant are the ones who are most exposed to this kind of risk factor, not the patient. The patient will go home at last, but you are the one who will be in the environment. So it is important to properly dispose of the amalgam after you have used it. The next